Dr. Jaffe, what is the role of the pineal gland, especially in sleep?
Well, it's a very important controlling gland in the deep brain. It's actually quite small, but interestingly, there is a nerve connection between the eye and the pineal. And importantly, the messages produced by that pineal gland through the thalamic structures tell the pituitary gland what releasing factors to release. Now, the pineal gland likes green light and it's suppressed by blue light. So we recommend 20 or 30 minutes a day of green light therapy. You can look that up under drrusselljaffe.com. And I also want to mention that while it is now known that melatonin is produced in the pineal gland and the amount of melatonin that can be produced is dependent on the amino acid tryptophan, which we suggest in enhanced uptake form, so that in the brain, serotonin and melatonin can be made safely and effectively where and when needed. In contrast, if you take melatonin as a supplement or as a medication, that's a kind of pharmacology. And we know in neurobiology that if you take external melatonin, the feedback effect is to suppress your brain's ability to make its own melatonin. That's not to your benefit. What is to the benefit of everything, including restorative sleep, are to make melatonin in the pineal gland from tryptophan through serotonin and avoid excitoneurotoxins that can easily form if you take external melatonin. Now, the pineal gland is involved with emotions of life. The Molecules of Emotion book by Candace Pert describes in great, elegant detail the functions of this pineal gland. We have found green light, abdominal breathing, slow, deep abdominal breathing, and relaxation response or mindfulness practice or meditative practice or prayer to all be beneficial to this neurobiological web of life controller called the pineal gland. If you're interested in biorhythms and day-night cycles, they are greatly influenced by the pineal gland. So for healthy nerves, hormones, immune defense and repair system functions, and everything from the microbiome digestion to the biodetoxification in metabolism, all of this is better for healthy, natural function of the pineal gland. So now that you know, you will help yourself, perhaps by taking enhanced uptake tryptophan about a half an hour before you're going to bed, because as an amino acid, it should be taken on an empty stomach. And if you take it a half an hour ahead of time, it will reach the peak blood level about 30 minutes later, easily taken up from the stomach. Now, if you don't take it half an hour ahead, you will still get about 3/4 or 80% of the benefit if you take it just as you're falling asleep. It will help with these 90-minute restorative sleep cycles. In the brain, there are 4 stages to sleep, and one of those, stage 4, of deep sleep is a very small 5 or 10 minute window within which the pineal talks to the pituitary and the rest of the body. What does it instruct? Well, it instructs surveillance so that every cell in the body is touched and abnormal cells are programmed for deletion by what's called apoptosis. The first 3 or 4 of these sleep cycles are essential for restorative sleep. My bedroom tends to be cool, dark, and have no Wi-Fi or devices in it. And it provides me, at least, the joy of restorative sleep. So be good to your pineal gland and it will be good to you.